Something is happening to millions of seniors right now, tonight, while they sleep. And the terrifying part is they have absolutely no idea it's occurring. A man named Gerald, 67 years old, healthy by every measure his doctor could see, went to bed one Thursday evening and never woke up. His wife told investigators he had been snoring loudly for years. She thought it was just snoring. His cardiologist thought the same. Nobody connected the dots until it was too late. What Gerald had is something an estimated 38 million Americans share. Most of them have never been diagnosed, and the research coming out of major cardiac institutions over the last several years is making doctors genuinely alarmed, because this condition doesn't just make you tired in the morning. It quietly destroys your cardiovascular system night after night, year after year, until your heart simply can't take it anymore. If you snore, if you wake up exhausted no matter how long you slept, if your partner has ever told you that you stopped breathing during the night, or if you have high blood pressure that your medications can't seem to fully control, please do not leave this video. What I'm about to share with you could genuinely save your life. I'm Dr. James, and this channel is dedicated to bringing you the latest, most evidence-based health information, specifically designed for adults over 60. We translate the medical journals, so you don't have to. If you haven't subscribed yet, I'd encourage you to do that now so you never miss a video like this one, because this information isn't making headlines the way it should be. So let's get right into it, because you deserve answers, not suspense. The condition at the center of Gerald's death, and the condition that may be silently threatening your heart right now, is called obstructive sleep apnea. And before you say, "I've heard of that, Dr. James, it's just snoring," I need you to pause and truly understand what is actually happening inside your body during one of these episodes, because most people have no idea. When you fall asleep, the muscles in your throat relax. For most people, this is completely normal. But for roughly 1 in 4 adults over 60, those muscles relax too much. The soft tissue at the back of the throat partially or completely collapses and blocks the airway. Your airflow stops. Oxygen stops reaching your lungs. Your blood oxygen levels begin to drop. Your brain, desperately sensing the danger, sends an emergency signal throughout your nervous system. Your heart rate surges. Your blood pressure spikes. The stress hormones cortisol and adrenaline flood into your bloodstream. And finally, you partially wake up, just enough to gasp, reopen the airway, and begin breathing again. You almost never remember this happening. Here is what makes this so devastating. This cycle can repeat itself 5, 20, sometimes 60 or more times per hour. 60 times per hour. Every single night. You go to bed thinking you're resting, and what's actually happening is that your cardiovascular system is enduring the equivalent of repeated emergencies all night long. A landmark study published in the Journal of the American College of Cardiology followed over 5,000 adults with untreated sleep apnea. The researchers found that participants with moderate to severe sleep apnea had a 2 to 3 times higher risk of suffering a heart attack or dying from cardiac causes compared to those without the condition. 2 to 3 times. That's not a small statistical blip. That's a fundamental transformation of your risk profile. And it doesn't stop there. The stroke connection is equally alarming. A comprehensive analysis published in the Annals of Neurology looked at data from 19 studies involving over 42,000 participants. The conclusion was clear and consistent. Untreated sleep apnea nearly doubles the risk of ischemic stroke, the most common type where a clot cuts off blood flow to part of the brain. Why does this connection exist? The mechanism is actually quite logical once you understand it. Every time your oxygen levels drop during an apnea episode, several harmful processes are triggered simultaneously. Your blood becomes more viscous, meaning thicker and stickier, which dramatically increases the likelihood of clot formation. The repeated blood pressure spikes damage the inner walls of your arteries over months and years, creating the exact kind of micro-injuries where plaque buildup begins. And the chronic release of stress hormones drives systemic inflammation throughout your entire vascular system. Think of your arteries like garden hoses. Healthy arteries are flexible, smooth on the inside, and able to handle pressure changes. Now imagine hitting that hose with a hammer several hundred times every single night for 10 years. Eventually, the damage accumulates to a breaking point. That's what untreated sleep apnea does to your cardiovascular system. Here's what I want you to comment on right now. In the comments below, tell me this. Do you snore? Or has anyone ever told you that you stop breathing during sleep? Just comment yes or no. I want to get a sense of how many people watching this video may be at risk, and your answer could help someone else in this community take this seriously. Now let's talk about the hidden epidemic aspect of this, because what truly troubles me about the research is how many people have absolutely no idea this is happening to them. A major analysis from the American Academy of Sleep Medicine estimated that approximately 80% of moderate to severe sleep apnea cases in adults remain undiagnosed. 80%. That means if you're over 60 years old and you haven't been specifically tested, the odds are not in your favor when it comes to knowing whether this is silently damaging your heart. The reason it goes undetected so often is that the symptoms are embarrassingly easy to explain away. You're tired during the day? You're 65 years old, of course you're tired. You wake up with a headache? Could be the weather or your pillow or a dozen other things. Your blood pressure is elevated even though you take your medication faithfully? Well, hypertension is complex. Your doctor increases the dose and moves on. Nobody asks the question, what is happening while you sleep? I want to share a story with you about a woman named Dorothy, 71 years old, who came to us after her third blood pressure medication adjustment in 2 years. Her cardiologist was frustrated. Dorothy was frustrated. She was taking her pills every morning without fail, eating well, exercising in her garden 3 times a week. Yet her blood pressure remained stubbornly elevated, sometimes dangerously so in the early morning hours, which is precisely when most heart attacks occur. When we finally conducted a sleep study, the results were startling. Dorothy was experiencing 47 apnea events per hour, nearly 1 per minute throughout her entire night. Her brain was triggering those blood pressure emergency surges so often that her vascular system literally never fully recovered before the next one hit. When we treated her sleep apnea, her morning blood pressure numbers dropped by 22 points on the systolic reading within 8 weeks. Not because we changed her medication, because we stopped the thing that was causing the problem. Dorothy's story is not unique. Research published in Hypertension, a flagship journal of the American Heart Association, found that successful sleep apnea treatment reduced systolic blood pressure by an average of nearly 10 points in patients with resistant hypertension, meaning blood pressure that doesn't respond well to medication. For context, every 10-point reduction in systolic blood pressure is associated with roughly 25% reduction in cardiovascular mortality. That is an enormous effect from treating something that most patients and many physicians are simply not thinking about. Now, here's the part of the video I really need you to stay for, because this is where most health content fails seniors. They tell you what's wrong. They don't tell you what to actually do about it, and doing something about this is absolutely possible. But before that, let me ask you something that I think is important. Have you ever told your doctor that you're tired during the day and been told, well, you're getting older, that's normal? Comment below if that's happened to you, because the research now makes it very clear that excessive daytime sleepiness in someone over 60 should prompt immediate screening for sleep apnea, not a shoulder shrug about aging. Let me explain the full picture of what we know about the specific mechanisms linking sleep apnea to your heart, because understanding the why makes the solution make so much more sense. During normal healthy sleep, your blood pressure actually drops by 10 to 20%. Sleep researchers call this the nocturnal dip, and it is a critical period of cardiovascular recovery. Your heart gets a break. Your blood vessels get a break. Your entire system uses these hours to repair the micro damage from the day's activity. People with untreated sleep apnea often don't experience this dip. Instead of their blood pressure falling during sleep, it remains elevated or actually rises during the night. These individuals are called non-dippers, and a large study published in the European Heart Journal found that non-dippers have significantly higher rates of heart attack, stroke, and cardiovascular death compared to people who show the normal nighttime blood pressure reduction. The sleep apnea is stealing the most important recovery time your heart has in every 24-hour period. There's another piece of this that most people haven't heard discussed anywhere, and I think it's the most important thing I'll tell you today. Recent research from Harvard Medical School examined what happens to the heart's electrical system during sleep apnea episodes. What they found explains why some people, like Gerald, experience sudden cardiac events during sleep without any prior warning. The oxygen desaturation during apnea episodes can trigger dangerous heart rhythm abnormalities, particularly a condition called atrial fibrillation, which is an irregular, often rapid heart rate that dramatically increases the risk of stroke-causing blood clots forming in the heart. A meta-analysis of 14 studies found that sleep apnea is associated with a twofold increased risk of atrial fibrillation. More critically, patients who have atrial fibrillation and also have untreated sleep apnea are significantly more likely to see their atrial fibrillation return after successful electrical or procedural treatment. The sleep apnea is driving the arrhythmia. This is why cardiologists at the Cleveland Clinic and Johns Hopkins now routinely screen cardiac patients for sleep apnea before any major intervention. Because treating the heart problem without treating the sleep apnea is like bailing water from a boat without plugging the hole. Here's what I want you to do after you finish watching this video. And I'm going to be very specific, because vague advice doesn't help anyone. First, tonight, or at your very next opportunity, ask your bed partner, if you have one, these 3 direct questions. Do I snore loudly, meaning loudly enough to be heard through a closed door? Have you ever noticed me stop breathing, gasp, or choke during sleep? Do I toss and turn excessively or seem restless all night? If the answer to any one of those questions is yes, that is clinically significant information that needs to reach your doctor. Second, take the Epworth Sleepiness Scale assessment. You can find this by searching Epworth Sleepiness Scale on Google. It's a free, validated 8-question tool that takes about 2 minutes to complete. A score above 10 suggests significant daytime sleepiness consistent with a sleep disorder. Print it out or write down your score and bring it to your next appointment. Third, and this is critical, when you speak to your doctor, use these specific words. I would like a referral for a sleep study to rule out obstructive sleep apnea. Don't ask if you might have it. Don't describe your symptoms and wait for them to bring it up. Make a direct request for the specific test, a home sleep test, which your insurance almost certainly covers after age 60, can be done in your own bed without any clinic stay. It monitors your oxygen levels, heart rate, breathing patterns, and movement throughout the night. Results come back typically within 1 to 2 weeks. Fourth, if you are diagnosed with sleep apnea, the gold standard treatment is continuous positive airway pressure therapy, what most people know as CPAP. I know this device has a reputation. I hear from patients regularly that they tried it once, found it uncomfortable, and gave up. Here is what I want you to know. The discomfort from CPAP is almost always a fitting issue, not an inherent problem with the therapy. There are now over 100 different mask styles available. Heated humidification has eliminated the dry mouth and throat issues that plagued older machines. Auto-adjusting pressure settings mean modern CPAP devices are incomparably gentler than the machines from even a decade ago. If you tried CPAP years ago and stopped, please try again with current technology and a certified sleep specialist who specializes in fitting. The cardiovascular benefits are simply too significant to abandon. Fifth, if CPAP truly doesn't work for you, and there are a meaningful number of people for whom it doesn't, there are legitimate alternatives. Oral appliance therapy, prescribed by a specially trained dentist, repositions the jaw and tongue to maintain airway openness during sleep. Multiple studies show it reduces apnea events by 30 to 60% in mild to moderate cases. For severe positional sleep apnea, meaning apnea that occurs primarily when lying on your back, a positional therapy device can be life-changing. These are wearable devices that gently prompt you to shift onto your side when you roll onto your back, and research shows they can reduce apnea events by 40 to 60% in position-dependent cases. Weight is also important to mention because carrying excess weight, particularly around the neck and midsection, is one of the strongest modifiable risk factors for sleep apnea. A reduction of just 10 to 15% of body weight in overweight individuals with sleep apnea has been shown to reduce the severity of the condition by 30 to 40%, according to data from the Sleep Ahead study, which followed over 2,000 participants over 10 years. Now, I want to address something that comes up frequently in my discussions with patients about this topic. Many people believe that if they were sleeping in a dangerous condition, they would know. They trust their body to alert them. I need to gently but firmly challenge that belief because it's one of the most dangerous misconceptions in senior health. Sleep apnea, by definition, occurs while you are unconscious. The arousal that ends each episode is so brief that your conscious mind never registers it. You can cycle through dozens of these events every hour and wake in the morning with no memory whatsoever of anything unusual happening. The first sign is often exhaustion, high blood pressure, or, in the worst cases, a cardiac event. Waiting for your body to tell you there's a problem is not a strategy. Testing is. One more thing I want to address before we close, and it connects directly to why Gerald's death was preventable. There is a specific time window during sleep, roughly between 3 and 6 in the morning, when the combination of natural circadian blood pressure rise, increased blood clotting tendency, and heightened stress hormone activity creates what researchers call a cardiovascular vulnerable period. This is why the majority of heart attacks and strokes occur in the early morning hours rather than distributed evenly through the day. In people with untreated sleep apnea, this vulnerable period is dramatically amplified. The oxygen desaturations from apnea events are often most severe in the later stages of the night when sleep is deepest and the airway is most relaxed. Add the natural morning cardiovascular surge to an already stressed, oxygen-deprived cardiovascular system, and you have the precise conditions under which otherwise unexplained nighttime cardiac deaths occur. Gerald was not unlucky. Gerald was unknowingly exposing his heart to catastrophic risk every single night for what his wife estimated was at least 8 years of escalating snoring. This information existed. This testing existed. The tragedy is that nobody put the pieces together in time. You have the opportunity to put the pieces together right now, today. The message from every major cardiac research institution conducting work in this area is consistent. Sleep apnea is not a sleep problem. It is a cardiovascular disease driver disguised as a sleep problem. Treating it with the same urgency you would give a new heart medication is fully warranted by the evidence. Here's what I want you to do right now. Leave a comment and let me know one of 3 things. Comment, testing soon. If you're going to ask your doctor about a sleep study after watching this, comment your age and whether anyone has ever told you that you snore or stop breathing during sleep, or comment sharing this if you know someone in your life who snores loudly or has hard-to-control blood pressure, because sharing this video could genuinely save their life. Sleep apnea affects seniors at dramatically higher rates than younger adults. The condition often goes entirely undetected for years, and the cardiovascular consequences of leaving it untreated are as serious as any heart disease risk factor your doctor has ever discussed with you. But here is what I need you to hold on to as the one thing you remember from everything I've shared today. This is diagnosable, this is treatable, and the benefits to your heart of addressing it can begin within weeks of starting effective treatment. If you found this valuable and you haven't subscribed yet, please take a moment to do that now, because next week I'm covering something that may surprise you even more. The common over-the-counter medication that over 40 million seniors take regularly for pain and sleep that significantly worsens sleep apnea and increases nighttime blood pressure. And most doctors never mention this connection. You don't want to miss that one. I'm Dr. James. Thank you for taking your health seriously. Thank you for watching. And take care of that heart of yours because the research is very clear. The nights matter just as much as the days.